Hello, today is the day 41 of 365 days project and I am here to discuss on diarrhea. Let's see the key factors of diarrhea. Diarrhea disease is the second leading cause of death in children under 5 years old. It's both preventable and treatable. Each year, diarrhea kills around 525,000 children under 5. A significant proportion of diarrhea disease can be prevented through safe drinking water and adequate sanitation and hygiene. Globally, there are 1.7 billion cases of childhood diarrhea every year. Diarrhea is a leading cause of malnutrition in children under 5 years old. Let's see what is meant by diarrhea. Diarrhea is defined as the passage of 3 or more loose or liquid stools per day. Actually, it's more frequent passage than is normal for the individual. Frequent passing of formed stools is not diarrhea, nor is passing of loose pasty stools by breastfeed babies. Acute diarrhea is defined as abnormally frequent discharge of semi-solid or fluid fecal matter from the bowel, lasting less than 14 days by the World Gastroenterology Organization. This is declared. Diarrhea is usually a symptom of an infection in the intestinal tract, which can be caused by a variety of bacterial, viral, parasitic infections. Infection is spread through contaminated food or drinking water or from person to person as a result of poor hygiene. Interventions to prevent diarrhea, including safe drinking water, use of improper sanitation, and hand washing with soap, can reduce the disease risk. Diarrhea should be treated with oral rehydration solution ORS, a solution of clean water, sugar and salt. In addition, a 10 to 14 day supplement treatment course of dispersible 20 mg zinc tablets shortens diarrhea duration and improves outcomes. Scope of diarrheal disease. Diarrheal disease is leading cause of child mortality and morbidity in the world and mostly results from the contaminated food and water resource. In low-income countries, children under 3 years old experience an average 3 episodes of diarrhea every year. Each diarrhea deprives the child of the nutrition necessary for the growth. There are 3 clinical types of diarrhea. Acute watery diarrhea lasts several hours or days and includes cholera. Acute bloody diarrhea, also called dysentery, and persistent diarrhea, lasts 14 days or longer. Another classifications as follows. Secretory. Secretory means there is an increase in the active secretion or there is an inhibition of absorption. Osmotic. Osmotic diarrhea occurs when too much of water is drawn into the bowels. If a person drinks solutions with excess sugar or excess salt, these can draw water from the body into the bowl and cause osmotic diarrhea. Exudative. Exudative diarrhea occurs when the presence of blood and pus in the stool. This occurs with the inflammatory bowel disease such as Crohn's disease and ulcerative colitis and even other severe infections such as E. coli or the other form of food poisoning. Inflammatory. Inflammatory diarrhea occurs when there is a damage to the mucosal lining or the brush border, which leads to passive loss of protein-rich fluids and decreased ability to absorb these loss of fluids. Dysentery. If there is blood visible in the stool, it is known as dysentery. The blood is a trace of invents of bowel tissue. Dysentery is a symptom of among Salmonella. Symptoms. Let's see that. The diarrhea refers to watery stools, but it may be accompanied by some symptoms. These symptoms include stomach pain, abdominal cramps, bloating, weight loss, fever, and chills. Let's see. Dehydration. The most severe threat posed by the diarrhea is dehydration. The degree of the dehydration is rated on scale 3, severe, some, and no. Severe dehydration, which occurs at least 2 of the following signs: sunken eyes, unable to drink or drink poorly, skin pinch goes back very slow, more than 2 seconds. Some dehydration, restless, irritability, drinks eagerly and more thirsty. No dehydration, no enough signs to classify as some or more dehydration.